Yeah?
Yep.
Yeah, excellent. Well, today in Queensland we're reporting 2 new cases of COVID-19. They're both linked to each other and we believe linked to the existing cluster around the Youth Detention / Correctional Training Academy, but that will be investigated today and we hope to have more information. They are a male and a female aged between 30 and 39 years of age. We understand one of them works in an aged care facility. That aged care facility has done everything that we have asked of them, and the Chief Health Officer will have very positive praise for the actions of the aged care facility in responding there. That means we're now close to 2 weeks since that first case was reported at the Brisbane Youth Detention Centre, and we continue to see small numbers of cases generally amongst those who've had contact with other confirmed cases. And that's really promising. It suggests that our efforts, that our rapid response is working. We now have 30 active cases, bringing our total here in Queensland to 1,128. We did 14,273 tests in the last 24-hour testing period, which again is really promising and can give us confidence that we are finding our cases if they are out there. You'll all recall that we announced some time ago a program to pop up fever clinics in tourist locations to ensure that if there were any cases of COVID-19 coming into the state via our tourism industry, that we would identify them. We've also been working with the University of Queensland on a surveillance program, a sewage surveillance program. Some results from that program have recently suggested that there may have been a case of COVID-19 in the Airlie Beach area, and with the utmost of caution, the Mackay HHS is standing up a fever clinic in Airlie Beach today. We'd like to emphasise that this is not considered a high risk. We are taking this action with the utmost of caution and as part of our regular program of popping up fever clinics in tourist locations. We simply want to see an increase in the level of testing in that area so that we can assure ourselves that there isn't cases of community transmission there that we don't know about, so that we can keep our tourism industry there safe and opening. Today we're here at the Redlands Hospital for a really important announcement. This hospital is an incredible part of the local community. They do a really great job. They became even more important after the Newman government closed down the Wynnum Hospital, leaving Redlands to service a much greater area. I was here not long ago to announce a very significant investment in a new multi-storey car park. And I said at that time that the car park was an important enabler for us to do future expansion here at the hospital. As you can see, you couldn't take car parks away for building, for new construction, because the existing car parks are already so overutilised. And so now that we have the car park underway, we can announce that the state government will invest $32 million into a stage 1 redevelopment of the Redlands Hospital. That comes on top of a $30 million commitment from the federal government, which of course we welcome, meaning that we will be able to invest $62 million in a major expansion here, stage 1 of a much bigger expansion down the track. It will allow us to build a new 32-bed ward as well as a new 6-bed intensive care unit and refurbish other parts of the hospital. It comes on top of recent enhancements to the emergency department and the birthing suites. Construction will commence in 2021 and we hope to have it completed in 2022. In the process, we will create 179 jobs in construction. We're also announcing today that we are providing $6 million of funding to the HHS to begin planning stage 2 so that people can see that we have a long-term plan to expand this hospital, invest in this hospital, because we understand how important it is to this local community, but also because but also because investing in new and better health facilities is a core part of our plan to unite and recover for jobs here in Queensland. We've said consistently that the first stage of our economic plan is managing COVID, but an element of our economic stimulus is also to continue to invest in those wonderful health services that have kept Queenslanders safe. I might just ask our local MPs to very briefly say something about this announcement, and then the Chief Health Officer is here to take any COVID-related questions. Mick?
Well, what terrific news that is for the Redlands community. There has never been a more important time in living memory for us to be investing in better health services, and it's wonderful to see this significant investment here for Redlands families. Just a couple of weeks ago, I had the privilege to visit with a new mother here, Annika, and her baby son, Nevaeh, and they sung the praises of the staff here and the new maternity facilities. Now to have the opportunity to be able to talk about this expansion, delivering the 6 ICU beds, the further emergency department capacity that's been delivered here and going to be continued to be delivered, builds real confidence in our community. That they know that if they need to bring themselves or a loved one here to this hospital, that they'll continue to get the very best, world's best care. Of course, the car park is a significant issue for the staff here and visitors to the hospital as well. And so the overall master plan for the hospital is delivering something for everybody. And as the Minister for Health said, quite importantly, this project will deliver 179 jobs for local tradies here in this community. It's all part of our plan to ensure the economic recovery of Queensland while we deliver important legacy infrastructure for Queenslanders, for people who call the Redlands homes.
Thank you. This is absolutely fantastic news for our Redlands community. Much awaited. The news of the car park recently expanding as the enabler for us to do further works here is just great news. The Palaszczuk Government continues to deliver for our Redlands community, particularly in the health services space. We know that the $6 million to look at the greater expansion of the hospital will be welcomed by our entire community. So we're excited here to be delivering more services for our Redlands community.
Thank you, DP, for coming out yet again. Obviously, a couple of weeks ago, we just had the announcement of the 7-level car park here, so it's fantastic to build on that even further with a 32-bed ward and also a 6-bed ICU, something that the local community has been calling out for years here in the Redlands, and it's only a Labor Palaszczuk government that is delivering on these health services, but also another $6 million to go into the planning and design work for the next phase of Redlands Hospital, making sure that we keep up with growth, keeping up with the elder population that's happening down here in the Redlands. I know it's something that I've been fighting for my local community for many years now, and I'm glad that the Premier and the DP have been listening to our calls, and we're delivering it here today.
Thank you very much. It's great to be here today at this fabulous announcement. And what this means for Baysiders is a close-to-home tertiary hospital delivering the best healthcare to Baysiders. We have a fabulous Wynnum Manly Community Health Centre that again was built by the Labor Palaszczuk Government. So we have a strong commitment to improving all of our health services, to be providing the best possible healthcare for all Queenslanders. So I'm really excited about this. What it means is Baysiders will be able to attend a hospital close to home and get the world-class healthcare that they need. So this is great news as we unite and recover from the pandemic.
It is absolutely fantastic news to see the expansion of this hospital. Before I became Chief Health Officer, I worked in Metro South and I saw this hospital grow from a very small hospital, and to see what's happening today is fantastic news. And that is the best way to grow a hospital. You start small and you just grow. And the final part of the puzzle, if I can put it like that, is the intensive care unit. Not only for those 6 beds that are there, but the fact that it elevates the care through the entire hospital. It increases the amount of teaching that is done, the amount of training that is done. So this is really, really good news for the people who live here. Care is always best if it can be provided close to home. We know that for so many reasons. Now, overnight in Queensland, we had 2 new cases of COVID-19 confirmed, both of them in people who are known contacts of cases and both contacts of each other. So that is good news. We're starting to see, 2 weeks into this cluster, that we've got control. It's too early to say we've solved it. We've still got a long, long way to go, but we can see that we're getting a couple of cases each day. So that is really good news. And that is due to the work done by the community with those very strict restrictions that were put back in place. People adhered to them. And it's also a fantastic result from all of the healthcare staff involved. We have seen what Westmoreton has stood up and done and the clusters that they're managing out there, and their very, very rapid response last night when they got told of 1 case in a staff worker in the Laidley Aged Care Facility. They immediately activated their plan. Now, fortunately, that staff worker did not work while symptomatic. They were very, very appropriate, got themselves tested and so forth. But we know that you're actually most infectious before you have symptoms. But because of the process that was put in place, getting aged care facilities to manage their facilities, to manage the risks, to use PPE, the risk for that facility is very low. But we will now, of course, be testing all of the residents, all of the staff, and some of the staff have had to go into quarantine, but that's our plan and that will all be managed. Now, you also heard that because of a test of the sewerage done in Mackay in Airlie Beach 2 weeks ago, which came up potentially positive. It's very early days for sewage testing. We're not quite sure what it means, but the Hospital and Health Service very prepared, and they have indeed already stood up a fever clinic there just to increase the surveillance. We know that Airlie Beach is a tourist destination, so a lot of people travel there from within Queensland and indeed from other states where the borders aren't closed. So it's important that we just are a little bit more alert wherever we've got tourists coming, because we know the risk is a bit higher. So they've been very proactive. They've stood up their clinic and they'll do some enhanced testing of the people who live there. We don't know what this means, because you might remember that we've had a number of ships off the coast there with positive cases, so we're just not sure where this might have come from, but it doesn't really matter. The response is the important thing, so that's in place. Then, as we continue with these increased cases in the southeast, it's really important that people continue to follow all of those firm restrictions. So we really can't have gatherings of more than 10 people unless there's a COVID-safe plan in place. That means in people's homes, because we are through this cluster seeing that wherever you've got a case in a home, rapidly the other people in that home are getting infected. We know that's the case, particularly early on in a outbreak. We know the home is the riskiest place. So that's why those gatherings limited to 10 in people's homes are so important. Then we must protect our vulnerable. The work that was done to protect the Laidley Aged Care Facility means that the risks for those residents are so much less. So I know it is really difficult, and the second that we can remove these restrictions, we'll do that. But at this point in time, this is not the time to be visiting in real life, face to face, your relatives in aged care. Use other means, so telephones, Skype, virtual means. That's important. We must keep our most vulnerable people, and they're the people who live in our aged care facilities, as safe as we possibly can. Then we also know that our prisoners are amongst the most vulnerable people. So we're working very, very closely with Queensland Corrective Services to work through what is happening in our large number of our prisoners, where we've got some cases in the staff. So that's all being sorted through as we speak. Thank you. Happy to take questions.
It's Father's Day on Sunday. What's your advice to people going to visit their
Yep. If you don't live in that normal household, delay your hugs for Father's Day till this is all over, because that is the best gift you can give your father. You don't want to give your father COVID-19. So definitely join in groups of up to 10, but be really careful with the more vulnerable people. So I suppose I was thinking of my father, who's into his 80s when I was saying that. If your father's, 30, then of course there's a difference there. But for anyone who's in that vulnerable cohort, in that older group, or has significant chronic disease, immunocompromised, now's not the time to give them a hug, but see them, talk to them, visit them. Human interaction is absolutely critical, of course.
Some of the 2 new cases, they were close contacts with previous cases. Does that mean they were friends with them, or had they visited a place that the other infectious people had visited? How do you think?
We're working through that at the moment to exactly find out where that contact occurred, but we're pretty confident at this stage that they've had contact with a confirmed case.
At Laidley, you said that the person there, the staff member, didn't work while symptomatic. Were they working before that?
Yes.
So potentially while they were in their most infectious period?
Yes.
Right. So what happens now? Does every resident there have their own room? Are people going to be moved out of there? What's actually happening on the ground?
So that's a very, very good facility. They had their COVID safe plan, they put it into place, so they're just working that through at the moment. They've got a little bit of spare capacity, so they believe that they can make sure that each resident has got their own bathroom. So that's all being sorted through at the moment. So the staff worker worked in a staff area. They didn't have contact directly with any of the residents, so the staff members that they had contact with will need to go into quarantine. But they were all wearing PPE, which was the requirement that we put in place a few weeks ago, and they were adhering to that.
And how many residents will have to get tested?
All the residents in the facility.
Is that hundreds?
No, it's a reasonably small facility, as you'd expect for a community that size.
And how many cases are now linked to the cluster?
So we've now got 30 active cases today in Queensland, and the vast majority of those are linked to that cluster, to the Brisbane Youth Detention Centre and to the Training Academy. We've seen some definite links between those 2 clusters, but we haven't worked through all of the people. We think they're probably all completely linked, but we just have to finalise all of those details.
On the AFL, can you explain how having 30,000 people at the Gabba is going to be able to adhere to social distancing rules? Because at the moment you've got a row between people, but 30,000 people, you're not going to be able to have that.
Yep. So today you can have 20,000 people at the Gabba, and that's been done multiple times and very, very safely. So the plan is, depending where we are in Queensland on the 24th of October, we'll make a decision whether it's safe to have that 30,000. We've got to remember all of these plans were being developed when we had no community cases, no community transmission in Queensland, and things looked pretty good going forward. Now that we've had this particular cluster related, I think, due to those 3 young women who went to Melbourne, we've had to rework that. So of course we're working that through with the AFL. So I'm very confident that the 24th of October is still a good solid 6 weeks away, and we've started to see some control over this current cluster. We'll keep on testing, and we're testing large numbers of Queenslanders, which is excellent, so we make sure that we're not missing any chains of transmission out there. Then we should be able to have that 30,000. But that 30,000 is not an absolute given today. The 20,000 is, unless of course we had a complete disaster in terms of case numbers. I'm pretty confident that we should be able to manage that 20,000. We've managed it many, many times, and I'm very hopeful that we'll be able to go up to that 30,000.
So just to be clear, that would be your call, obviously. Because Gil McLaughlin yesterday said we'll have 30,000, it's going to be great, but it's your call.
Of course it is. I am confident though. I genuinely think that we will be able to manage this. I mean, we have got really good systems in place. I was thrilled last night to see the response to that one staff member who'd worked at that Laidley aged care facility. It just happened. bang, bang, bang. They knew exactly what they were doing. This is a small facility in a rural area, and they knew exactly what to do, and it was handled beautifully. And that's what we're doing. Every single case in Queensland, we get on top of immediately and we respond. And those are the sorts of things that will keep us all safe and mean that we can very, very safely hold a large event like that on the 24th of October.
Staying with the AFL, there's reports, I think the NT newspapers are running them, that they've been in touch with some Victorians who plan to travel to the Northern Territory, I believe. They're going to do the quarantine there, and then when they're out, they would then have the green light coming to Queensland. Can you just clarify whether or not that's possible and what your thoughts on those plans would be?
Anyone who's been in the Northern Territory and has not been outside the Northern Territory in the previous 14 days can come to Queensland. They don't have any cases of COVID. It's a long, long time since they have had. The Northern Territory is very, very safe. Now, it's up to the Northern Territory whether they want to provide a quarantine hub for Victorians. That's their decision. But once someone has been in the Northern Territory for 14 days, then they are perfectly safe to come to Queensland.
That includes, it doesn't matter if you're a Victorian resident.
No, because you've done your 14 days quarantine, so you're perfectly safe. As I say though, that is then of course up to the Northern Territory whether they're prepared to be a quarantine hub for people from other states who want to go there and then transit through to Queensland.
And just on that, Dr. Young, how come then Victorian residents can't come to Queensland and go and pay for their own hotel quarantine here?
They can if they have a reason to come to Queensland. So every single day I am signing off exemptions, and I now have a large team who's assisting me with that because we're getting so many requests now. If they have a reason to come to Queensland, so they have a relative who needs their help, or they've got jobs here, because you've got to remember there's always a large net migration out of southern states to Queensland normally. People come to Queensland for jobs, and those things are still happening. So as long as they have a reason to come to Queensland, then yes, of course, they quarantine for 14 days and then they can go about their lives.
Coming to the footy is not a reason though. Coming to the footy, wanting to come to the footy, that's not a reason?
No, that's not a
But if
reason.
they go to the Northern Territory, they don't need an exemption to come into Queensland?
No, they can just travel. Anyone can travel into Queensland today unless you've been overseas, and of course you need to then go into quarantine in wherever you first arrive in the country. And for Queensland, anyone who's been in Victoria or New South Wales or ACT, unless they live in the border zone, the declared border zone in New South Wales, will need to quarantine when they come into Queensland.
There's going to be people in Victoria hearing you say that. They would have seen the 3 plane loads of 400 people have come in. I understand there's a very strict COVID plan around them, but that does include, I understand, some families and all those sorts of things. Can you justify to them, well, why are they allowed to fly in for the grand final? Some of them aren't operational, but a fan wouldn't be allowed to fly in for the grand final.
Because those people are supporting the people who are putting this event on. This event is an important event and it needs to be put on under a COVID-safe plan, which has happened. So the people who are involved in putting that event on, whether they be journalists, I know I've approved quite a number of journalists, TV, anchor people, camera people, etc., to come in. And all of them are going into hotel quarantine. Now, the AFL has stood up a hotel to do that, and they are managing that. So that is not an impost on us. So we currently have 24 hotels in Queensland that health and police are managing together. This is an additional hotel on top of that number. So it's not stopping other people coming into Queensland who have those reasons that they can travel into Queensland for.
Do you think the border, is there a chance the Queensland border may open to New South Wales before the AFL Grand Final?
At this point in time, the trigger to open the border to New South Wales is when they have had 2 incubation periods of no community transmission. Yesterday they had 1 case, so they are getting there. Now, if they were to have 28 days of no community transmission, that's the current definition, to open the border, then that would occur.
DP, can we just
Sorry, one more for Dr. Young, if that's okay. What do you say to people who say that Queensland has a double standard when it comes to border exemptions?
No, it's the one standard. It's done by a team that I manage, and the standard is that we keep Queenslanders safe, that we know that the highest risk of bringing the virus into the state is from areas that have higher amounts of community transmission. We do at the moment have our own cluster, and there's a lot of work that's working through at the moment, that we need to make sure we keep our people who live around those clusters safe. But we know that bringing in people from areas of the country or overseas that have significant amounts of community transmission are a risk, and that's why we have a quarantine process in place.
We've heard today that the Together Union 50,000 workers are getting a pay rise 1.75% from today. How does that gel with the pay freeze and all that before?
Look, the pay freeze applied to all enterprise bargaining agreements negotiated by the government. I understand the Industrial Relations Commission has adjusted the award rate, which is the minimum rate that all employers have to pay, and that will be applied.
What sort of workers are they?
There are a range of public sector workers, many of them frontline, so people like child safety workers, that kind of thing.
Can I just ask you?
I don't have that level of detail, Patrick. I'm sure we can get it for you.
It's a bit misleading. The Premier announced a pay freeze. It became a deferral that saved no money. It was supposed to start April 2. It then started July 1. Now we're in September and there's another pay rise happening.
Adjustments to the minimum wage apply to all employers, and I'm sure you would expect the state government to comply with the law, as we would expect every other business. But the component that we had control over is the enterprise bargaining agreements that we negotiate with unions and our employees, and they have all been frozen for this financial year.
The union said it negotiated this when it was talking to you about the legislation. So how long have you known about this?
Well, the Commission only just made its decision, as I understand, and so there was no forewarning that this decision, what this decision would be. It affects the minimum rates of pay that all employers, so all employers have awards that underpin their enterprise bargaining agreements, and in this case, the Commission has determined to adjust the award rates of pay.
What do you know with the situation?
Look, I don't know of any other decisions that are pending, but as you'd expect, the state government will comply with the law.
What do you know about the situation out of Redlands? More riots again this week?
Look, I understand there's been some unrest overnight at Redlands, but the information I have this morning from the Minister for Prisons, Minister Ryan, is that things are back to a steady state at both that prison and others, Arthur Gorrie, that there is not ongoing unrest today. Look, obviously it's not great to have our prisoners in lockdown, but it's what we need to do to keep them safe, to ensure that we don't have an outbreak in the prison.
Can I just ask you on hotspots, how interested are you in coming to an agreement on a national definition of hotspot?
Look, those matters will be discussed by the state and territory leaders with the Commonwealth at National Cabinet, and I'm not going to preempt that. All I would say though is that it's incredibly important that states have the ability to manage outbreaks in their own states based on the circumstances of those outbreaks.
You've got the proposal,
It's been.
though. It's gone to you guys. What do you think about it?
So I know I don't have the proposal. It's Cabinet in confidence.
Surely
but
we need some sort of national
hey,
consistency.
I want to answer your last question, Claire, before Alison interrupted me. Before. It's important. It's really important that our Chief Health Officer continues to have the powers that she needs to manage outbreaks here based on the information, the intelligence here, as well as what is happening elsewhere, and we'll look to pursue those rights. So, back to Claire's second question. No? Okay. Look, I understand those negotiations are commercial in confidence, but what I understand is also that the modelled economic contribution is much greater than the contribution that we've made to the cost of putting the final on. And I think all Queenslanders want to make sure that we do a really good job of this. We're custodians of a very, very special day for Victorians, and we want to make sure that we do a really good job, that we take care of it for them. We want to see them able to watch their great game, their great final, on their TV screens live from the Gabba, and I'm sure that we will, as we always do, put on a really fantastic event.
Oh, you're right. You
Sorry, just on that modelling while we're there. Can you just explain that, given that it looks like the border may be closed, I mean, I'm not an economist, but usually you need people to come from elsewhere to spend the money. If it's Queenslanders spending Queensland money in Queensland, how are we making money off the AFL Grand Final if it's two Melbourne teams?
First of all, that may be an economic contribution that people weren't otherwise making, but people will still be able to travel to Queensland from the other states and territories that are open, and the AFL is very popular in places like South Australia and Tasmania, and so I understand that modelling has been done, that it says that this festival of footy that we'll get to experience here, not just in Brisbane but right around the state, will make a very valuable contribution to the state.
Sure, but how is it any different if we've got 3 AFL games back to back across one weekend? They've got 20,000 that are happening now, and you can have 16, 20,000 in there. How is it any different?
Oh, look, people will travel from around the state as well as around the country to go to what will be an historic event. You know, more than a century since this game has only ever been played in Melbourne. To see it played in Brisbane at the Gabba, I think is great for the state, and I think it's pretty hard to challenge that something like that won't make an economic contribution. Just think about the promotion that it will bring Queensland and our Good to Go campaign nationally. Now that in and of itself has an enormous value. You just can't buy that kind of promotion for our state, to have the Gabba, to have Queensland beamed live into TV sets right around the country, right around the world. You know, it's something Queenslanders should be very, very proud of.
Gladys Berejiklian has said that Queensland's been unwilling to budge on any border issues, and that Southeast is more of a threat to northern New South Wales than the other way around. What do you say to that?
Well, yesterday, New South Wales reported 17 new cases of COVID-19. We reported yesterday 2, today 2. It would be much harder for us to manage outbreaks, clusters like the one that we are, if we had cases coming in from other states. And so it's really important. Those border restrictions are really important. I've worked really closely with the New South Wales Health Minister. I know our Chief Health Officer works very closely with the New South Wales Chief Health Officer to manage those kind of border issues. I've said to you before that those that make it into the public discussion are a very, very small proportion of those that get dealt with and managed behind the scenes. I think it's also important to remember that New South Wales has its borders to Victoria closed at the moment, and so New South Wales knows how challenging it can be to manage these border issues. In fact, we assisted them when they put those border restrictions in place. But I'd underline that it is Queensland and the other states and territories with their borders closed whose economies have fared the best. And that's what was borne out in the data that was released yesterday. And so not only is it benefiting Queenslanders to have Queensland kept safe for Queenslanders, but it's benefiting the whole national economy. Look, as I understand it, Coralie is Labor's pre-selected and nominated candidate for the state election. I've heard no announcements otherwise.
Do you think it's a bit of a cheap play that the Labor Party is using these border closures as a campaign strategy?
Not at all. We have, throughout this entire year now, more than, I think, 210 days, we have managed this pandemic with only one thing in mind, and that is keeping Queenslanders safe so that we can keep Queenslanders at work. And that's what we continue to do.
So it will be an election strategy going forward, just playing up your response to the pandemic?
Our decisions, whether they relate to local declarations of hotspots or how we manage the health response locally or restricting people coming from other states with larger number of case numbers, our decisions are made by our Chief Health Officer each and every day, and in the case of borders at the end of every month, with only one thing in mind, and that is how to keep Queenslanders safe.
Can I ask a question to Mr. Brennan?
Oh, I have one too.
Okay.
Me too.
Go for it.
There's been some calls from Tenants Queensland to extend that eviction period by 3 months. What is that something you're considering?
Well, we would all remember that National Cabinet made the decision to extend a moratorium on evictions for residential tenancies, and I think that was an incredibly important decision to take. At that time, we were all asked to stay in our homes and not move around. The measures that the Palaszczuk Government put in place through a consultative process with representatives of both tenants and property owners have been very, very effective. They have contributed significantly to the health outcomes that we've seen in Queensland that has kept people at work. We've been constantly reviewing those arrangements throughout the course of the pandemic. At the start, we set up a COVID-19 housing security subcommittee with representatives from right across the property sector, Tenants Queensland and the REIQ, and they have been reviewing the effectiveness of those measures, and they continue to do that. Currently, some of those measures are due to expire on the 29th of September. That's some time away. We'll continue to work with the Housing Security Subcommittee to consider whether or not any of those measures need to be extended, and of course we'll continue to take on board the decisions of the National Cabinet and primarily the advice of the Chief Health Officer when it comes to keeping people in their homes safe.
Do you need to legislate that next week if that's the last week of Parliament, or can you do it with a regulation or a piece of paper?
No, a lot of these matters are allowed to be done by regulation, and of course there are measures that we can take into account throughout the caretaker period as well. Look, what we've learnt from this pandemic is that it's a rapidly changing environment, and our responsibility is to respond with agility with the purpose of keeping Queenslanders safe so we can keep them in work. We've done that in respect of a whole range of sectors, whether it's construction, whether it's residential tenancies or commercial tenancies, and so we'll just have to keep doing that until the pandemic concludes.
The 29th isn't that far away.
Mm-hmm.
When we expect to make a decision?
Oh, look, we'll make decisions on that over the next couple of weeks, and we'll have more to say on that. There are some elements of the reforms that we've put in place which I think are incredibly positive reforms where there is real consensus around, like the reforms that we put in place to protect Queenslanders experiencing domestic and family violence. Part of the conversation that we're having with tenants representatives and property representatives is whether or not we should make those enduring provisions. I very much support that. But the introduction of those measures at the start of the pandemic, we were able to introduce them with just a few days' notice, and so going forward we'll have to continue to respond. As you heard from the Chief Health Officer earlier, we'll make decisions on a regular basis based on the prevailing circumstances of the day, and so we'll just keep doing that. We'll watch it closely, but ultimately the decisions that we take will be based around keeping Queenslanders safe.
Minister, one from me. Residents have expressed outrage in the paper this morning about overdevelopment and houses being crammed into the Redlands area, particularly two homes on Broadwater Terrace which have just centimetres between them. Are you concerned that the development code isn't up to scratch? Is council doing enough to make sure Redlands isn't overdeveloped? I've read that.
Fair enough. I'm not familiar with those particular developments, and of course everybody around the globe is looking for more and more affordable places to live. Queensland is the #1 place in the country where people want to come and live at the moment, and we're still seeing people wanting to come here for jobs, for education, for the great health services that are provided here. And so some of those small lot housing developments make those homes affordable. It is a responsibility of councils to make sure that they get their planning schemes right. And of course, I'm interested always to ensure that properties are built with a level of sustainability and livability for those Queenslanders that call them home. So I'm happy to have a look into any of the particular circumstances, but I know that the housing industry is keen to ensure that we continue to see new homes being built. In fact, an interesting statistic that I've picked up this morning is that there has been a 15% increase in the number of Queensland home warranty schemes written this year compared to this time in 2019. What that signifies is that people are continuing to invest in their homes, new homes, renovations. That's great news for those tradies working in the construction industry in Queensland.
All good?
Thank you, everyone.